In this lecture, we are going to discuss the clinical case of the hyperthyroidism. We will discuss the clinical manifestations of the hyperthyroidism. Then we will see the different tests that are involved in the diagnosis of the hyperthyroidism. And last, we will see the treatment. What will be the treatment of the hyperthyroidism? So let's get started. First of all, a 28-year-old woman comes to the clinic complaining of what will be the complaints of this woman. First is the weight loss of 8 kg over the last 3 months despite eating more than usual. So that is an important thing. This woman is eating normally or more than usual, but still her weight is losing, and 8 kg over the last 3 months. Next, feeling hot. She is feeling hot while others are comfortable in the same environment. Other peoples are normal or feeling normal, but she is feeling hotter temperature as compared to the other ones. Third is the excess sweating. Fourth is the palpitations. She is feeling her heartbeat. So that is the palpitations. Next is the nervousness and irritability. And next is the trembling hands. When she stretch her hand, and after that her hand starts trembling. That is another important thing. And last is the difficulty sleeping, specifically at the night. So these are the different complaints of her. If we see what the patient says, I feel restless all the time. My heart races even when I'm sitting quietly. I am eating more than before but still losing weight. So this is the statement given by your patient. So here is an important thing: restless, my heart races even when I am sitting quietly, and eating more. So these are the three most important things that she said in her statement. After, if we move towards the physical examination, general appearance, she is looking anxious and restless, and her skin is warm and moist. So this is the general appearance you are looking. Vital sign: pulse is 120 beats per minute while the normal is 60 to 100. It's high, it's tachycardia, high heartbeat. BP is blood pressure is 140 by 70 mm mercury. So its systolic is high. Normal will be the 120, but it's little bit high. Temperature is normal. So these are the different vital signs. Hands: fine tremor when hands are stretched out. That we have already discussed. When she stretched her hand starts trembling like this. So these are the different physical examination. In the neck, you will see the diffusely enlarged goiter. Neck is swollen. So again, that is also part of the physical examination. And eye examination, you will see the bulging eyes, and bulging eyes is called exophthalmos. Bulging eyes, and she is looking or staring at someone, but patient is normal. We just consider that that person is staring at me, but that person is actually not staring at you, because her eyes presenting with bulging. So that is another important thing in the physical examination. In the investigation, in the TFT report, thyroid function test report, FT3 and FT4 is high while TSH is low. That is normal. When the T3 and T4, FT3 and FT4 is high, that will give negative feedback mechanism and TSH start producing. And that condition happens in the hyperthyroidism. In the antibody test, TSH receptor antibody will be positive, so that it goes towards the autoimmune thyroid disease, and it is common in the Graves disease. Thyroid scan, in the thyroid scan, you will see the diffusely increased uptake of radioactive iodine. That is again in the Graves disease. So all the manifestations and the labs goes towards the Graves disease, and that is common in hyperthyroidism. Thyroidism. Hyperthyroidism due to the Graves disease. In the treatment, we will move towards the methimazole and carbimazole. So these are the two most important drugs that are helpful in the reductions of the thyroid hormones, because thyroid hormones is high. We have to reduce these hormones, and the patient will start taking methimazole and carbimazole. Patient will also have to take beta blockers like propranolol, because a patient is presenting with palpitations and the increased heartbeat. So you have to control the symptoms like the palpitations and heartbeat. So that's why we will add the beta blockers in this treatment. Radioactive iodine therapy in some patient, depending upon, it will vary according to the patients. And thyroidectomy, removal of the thyroid, that will also be decided according to the uh, conditions of the patient. So these are the different treatment options in the Graves disease or hyperthyroidism. So this is all about the hyperthyroidism, clinical manifestations, labs, and the treatment. So if you still have any question, you may ask in the comment section. Thank you so much.